My name is Terry Adirim. I am a pediatric emergency physician, currently professor and chair and senior associate dean for clinical affairs at the Florida Atlantic University College of Medicine in Palm Beach County, Florida. Up until February 1st, I was a senior executive in the military health system at the Department of Defense, one of the largest healthcare systems in the United States, and previously was a federal senior medical official during the 2009 H1N1 pandemic. And up until this year, I worked clinically in emergency medicine on the front lines, like many of you. Thank you to Leapfrog Group for giving me the opportunity to talk to you today about strategies to augment capacity at your hospital to handle COVID-19 patients. Hospitals in the parts of the country that are being overwhelmed, such as Seattle and New York, are already employing some of the strategies that I'm going to discuss with you. It is important that communities that haven't been hit as hard yet begin to plan now for the surge of sick patients, because it is coming and the epi curves do not look good. All hospitals should have surge capacity plans. As part of these plans, hospitals should be determining now alternate sites of care. First, consideration should be given to care that can be delivered virtually. Primary care, urgent care centers, and specialty care practices should be determining which patients can be managed virtually and which require in-person visits. Phone triage protocols should direct patients to virtual care when appropriate. Clearly, some patients will need to be seen in person for non-COVID-19 related issues. Some patients will still need home visits, most especially for medically complex patients. But it's helpful too to determine who can be managed through remote monitoring and who needs that inpatient visit. These strategies could help reduce the burden on the emergency department. Alternate care sites that hospitals should plan for and establish include temporary structures such as tents outside of the emergency department, and can be used in one of two ways, either as a site to triage patients or to cohort less sick patients who may be infected or anticipated to be discharged home and can serve as that site to offload the emergency department, which should be reserved for the sicker patients. Many hospitals have these plans already in place because they instituted these during the 2017-2018 influenza season, where surge capacity was required in many places. If you recall, the vaccine wasn't well matched, and during that flu season, some hospitals received so many patients that they had to set up tents adjacent to their emergency department. So they're well practiced in doing this. Inpatient units may require surge capacity, and this can be accomplished through multiple strategies, such as what we're seeing in New York, which is implementing field hospitals. Another strategy is to find places in the hospital that may not be in use or in as much use during the pandemic. Consider using recovery rooms, possible because of canceled elective surgeries, and other areas with beds not usually staffed. Also consider clinic rooms and research areas that may not be in use due to social distancing during the pandemic. For most hospitals, triaging patients off the ward is important. Sending patients home as quickly as possible is paramount. Send patients to rehab hospitals, for example. Also, those not infected with COVID-19 can go to nursing homes or adult congregate living facilities to complete their treatment. When planning tents and other alternate structures, staffing and materiel requirements will have to be considered. Work with your local and state public health departments to determine needs for National Guard, physicians, nurses, and other staff to fill the gap in that particular resource. And lastly, as the numbers of very sick patients increase and the fatality rate increases, plan for the possible need for surge capacity in your morgue. The HHS website, under the Assistant Secretary for Preparedness and Response, maintains a COVID-19 healthcare planning checklist that can help guide you in your surge planning. And lastly, what do you do with people who are homeless that you want to discharge from the emergency department? This has been a big concern amongst medical personnel, especially emergency physicians across the country. Some cities are using hotels and convention centers to house people who are homeless. They may also be a place to discharge homeless people who are infected, and large places like convention centers can allow for social distancing. Engage now with your local health departments to determine what their plans are for the homeless population, because they need to be taken care of as well. Thank you, Leapfrog Group, for giving me the opportunity to discuss this very important and timely topic.